Respected Mr. Rajan, Viheads, Vicky, dear friends, and very patient audience. I, in fact, never anticipated to be the last logger in this event, but as the task has come to me to conclude this session, if I go for the speech which I prepared, it will be too heavy, and it will be a sort of bombardment of adjectives. The situation is something like this. The last batsman in India-Pakistan series is expected to hit off a century to win over India. And I do wish at the end of the talk, I withstand to your expectation, and when we leave this hall, we will live it with concrete conviction and with a certain direction in which we collectively proceed together to further enhance our business of herbals and nutraceuticals. And I really feel, I am with you all, that it's too easy to bombard the suggestions, number of, very valued thought process from the podium, but it's equally difficult to digest and to implement it in day-to-day process as we are belong to the developing countries. Dear friends, today's script is on business opportunity, exports, marketing of herbals and nutraceuticals. The presentation is segmented in, of course, it was a small script, and because of unavailability of my co-speakers, I would be able to dwell upon more in detail on various points. What is nutraceuticals? What is the business opportunity? As mind-boggling figures are coming from various parts of the world, NAT is suggesting something. IBM is not undertaking marketing survey. Some agencies are doing their marketing survey, but the figures are different. In such a scenario, what should be the point of reference for we all? Global sales and marketing distribution. This point needs to be understood by even large players and small-scale entrepreneurs very precisely, because a lot more depends upon selection of business model. How do we go together? How do we plan our business, and down the line, how can we bring success to our business venture? Regulatory status of dietary supplements, for which Dr. Rajgopalan very precisely told that Biotechnology Act is going to be enacted soon, and he dwelt upon in great detail, but I also try to touch upon very superficially of for various countries, so we may understand that what are the entry barriers which prevent us to get to entry into various countries, and the most importantly, and the points which I love to discuss is various strategies to market the nutraceuticals. Dear friends, with your consent, I am moving forward. A dietary supplement is taken by mouth, intended to supplement the diet. It contains one or more of the following dietary ingredients, such as vitamins, minerals, herbs, amino acids, enzymes, organs, tissues, metabolites, extracts, and concentrates. Dietary supplements can be taken in form of pills, tablets, capsules, liquids. Its label clearly states that it is a dietary supplement. It must clearly state. Before I take you to this slide, it's essential for me to make it clear to the august audience that the source of information is new. There are three sources of information for collecting data for myself. I have been privileged to have been listed by Nutraceutical Business Journal, which is a San Diego-based company, which sends me all the subscription with no cost. I'm one of the contributors to their annual subscriptions, and this is the size of the industry which attracts everybody to look into this business opportunity. And there are reward figures, but I feel that the functional food is the right place where most of the Indian herbs are located, where Indian herbs are. They fit into the category of functional food. Because in US the survey has been done by and large by taking everything into the consideration. So the total market by the end of the 2003 is approximately $2.6 billion. It is likely to grow by 7% through 2004, expected to grow annually by various segments. Supplements 3%, natural and organic food is 9%, functional food by 7%, where most of the Ayurvedic and nutraceutical molecules which origin from India are. Personal care is 10%, nutraceutical industry overall by 6%. This is how the global nutraceutical market is fragmented. Obviously, US commands major market share, Europe comes next, Japan comes 18%, Canada comes next, 3%, Asia, overall Asia comes by 7%, Latin America comes by 2%, Australia and New Zealand putting together is hardly 1%. And Middle East, US and African countries command hardly 2% of the total market share of nutraceuticals. This is very important for each one of us to understand. This is the channel which gives directions to the nutraceutical cells, and whereby internet is once again emerging as one of the major business segments which gives rise to the sales of nutraceuticals, which is to the tune of 24%. Practitioner is responsible for 10%. Multi-level marketing, this magic world of MLM is bursting everywhere, not only in India. Somewhere down the line, the chains of multi-level marketing is ceasing, and that comes to the tune of 2.2%. Mail order, the country like Canada, Japan, where geographical conditions are not favorable, where by posting the mail, till the practices are very popular to obtain safe nutraceuticals. Retail order and mass marketing is 6.2%. Retail and national health food stores command the sales of 7.5%. Regulatory dilemmas. Of course, there are regulatory issues world over. European Union wanted to impose the law, but they have had to postpone this time deadline till August 2005. As in morning, one of the speakers said that August 2004 is the deadline for US for implementation of Bioterrorism Act. So ambiguity prevails everywhere. It is not only in India that the law for nutraceuticals is not well defined. Poor enforcement of regulations, it's everywhere. People do not understand how and where does the growth come from. Loopholes and ambiguity in regulations, it's a universal problem. Who regulates this internet site? I once again feel that it is ultimately the customer who emerges in total scenario as a victor. Customer demands the fate of the nutraceutical market. If I would put it very straight to you in this way, would not be exaggerative. Regulatory dilemma. Under DSHA Act, no claim can be made for dietary supplement to treat, cure, or mitigate a disease. How to draft a label for nutraceuticals is very well available on US FDA website, and certain norms are well defined. They are to be strictly followed. However, a dietary supplement can make claims that affects or maintain the structure or function of the body. In fact, I have had to spend great amount of time to understand what this structure and function claim of the body is. To simplify it further, it sounds something great, but to simplify it further, I would put it to you in this way that the soya flavon, though it does not contain any active estrogen into it, as it mimics the action of phytoestrogen, they are termed, it mimics. Mind it well, the word used for soya isoflavone is mimicking the action of phytoestrogen. It got termed as, it mimics the action of estrogen, it got termed as phytoestrogen. Regulatory status of dietary supplement in other countries than USA. Dietary supplement in US are guided by DSHA Act 1994. Many countries have framed their own guidelines in accordance with DSHA. The intent of enacting DSHEA was to meet the concerns of consumers and manufacturers to help ensure that safe and appropriately labeled products are available to all. It was only the growing popularity of nutraceuticals because of which this act got enacted by US Congress. In Australia, since I am touching upon, very superficially the global scenario of nutraceuticals, I would like to touch upon to this part of the world as well, that Australian Therapeutic Goods Act 1989 of alternative medicines can be listed with for a small fee without evaluation, provided that no specific claim is made for the efficacy. There is no available evidence of problems with quality and safety. More than 4,500 herbal preparations are on the list, and less than 5 are registered as a result of full evaluation of safety and efficacy. That is where Australia is at present. In Britain, certain specific form of herbal medicines are exempt from medicine license. You would be glad to learn that if we comply with the regulatory norms of Britain, it's too easy to get the entry. In present condition, maybe down the line after a year or so, if they decide to follow the European law, scenario may be different. But once again, it is within the country there is a strong resistance to implement that law. So they are just giving the dates. But a herb like ashwagandha, if we pack it in a good manufacturing unit with TSC-BSC capsules, with a magnesium stearate, which is from the vegetable source, with all the excipients which complies with British pharmacopoeia limits, we may very well export it as a food substance, not as a medicine, in a generic name, mind it, not with a brand name. Same as with France, official list allow, because certain herbs in UK like Boswellia serrata, Google, ashwagandha, Vidania somnifera, so on and so forth, there are more than 11 herbs which are listed and accepted in the British Herbal Medical Pharmacopoeia. In France as well, official lists allow more than 200 plants to be sold by the pharmacists. In Germany, of course they have a stringent law, but they allow 250 herbal medicine to be freely sold since they already established their safety and efficacy. And Denmark, Holland, and Sweden, their herbal remedies of Indian origin are being sold as food supplements. Overall summary seems to be something like this. Global market of $150 billion is dominated by US, Europe, and Japan. I would like to stress upon hereby to this august audience, though there are language barriers in Japan, but the per capita consumption of herbals are optimum in Japan than any other country in the world. Vitamin, minerals, and herbs dominate the category. Therapeutic point of view, with healthy growth rate, and regulation differs across the country, though DSHEA is commonly accepted legal framework. Consumers' perception and influence on herbal market, changing attitude, overall I am talking you about, changing attitude from ill to well-being across the practitioners and consumers, demand for natural products as prophylactic and therapeutic, disposable income available for healthcare worldwide, overall qualitative, there is a shift from epidemiological diseases as well from infectious diseases, pharma company driven patent education initiatives equally through the practitioners, and mass media expenditure spent by the companies are equally responsible for this hype of nutraceuticals. With this, what does India offer? This is what the point which interests me the most. With 16 agroclimatic zones, India is one of the mega biodiverse countries. India accounts 48% of the recorded plant species of the world. A raw material base for the creation of more complex semi-synthetic chemical compounds. Source of direct therapeutic agents. That is why Most of the herbal manufacturers from western part of the world are shifting their manufacturing base to India. Concept of herbals exists in India in all forms, in form of medicine, dietary supplement, food supplement, healthy tonic, beverages, veterinary medicine, human, veterinary cosmetic medicine, toilet soap, hair oil, shampoo and toothpaste. Flexible registration system, not stringent like any other country, for Ayurvedic and herbal-based nutraceuticals, and progressive export policy, as Mr. Rajan said. Positive support for foreign investment for executing global marketing by making India as a base. Dear friends, before I switch over to the further discussion of this couple of slides, I would like to go to the second slide first. This is my second last slide. There is no second guess that we should not do proper segmentation, targeting and positioning of the product. Because if some MBA guy would have been there in this audience, whatever I am going to deliver hereafter can be strongly objected. I come within the company where lots of MBAs work, and it is in fact within the resistance in the corporate to evaluate this business opportunity, which has further sharpened my skills. But I fully agree that there is no second option to segmentation, targeting, positioning of the product. They are equally important. But here, the marketing of food supplement is altogether a different ballgame. It is not very similar to that of what we are used to. A paracetamol is invented as antibiotic, and till time it gets vanished from the market, it remains antibiotic. Here it is not so. The herbs are multiform in their therapeutic efficacy, they are multidimensional, and it requires altogether different marketing view. Therefore, number of companies coming from the allopathic background got failed, not only in India, but in US as well. And they've had to wind up, after having worked hard, they've had to wind up their marketing operations. Food companies need to be leading edge in health space or someone else. This is what the health strategy consultants suggest. While big picture is favorable for the marketing, there is no guaranteed road to success for the marketing of functional food. The bolder the product extension, it was a lake race that product X is failing, let us make it X part, X plus. Here is the caution for all, those who are practicing this. The bolder the product extension, higher the likelihood of failure, says Med Jensen of Vitalive Calcium. Open-ended marketing of functional food is the safest and most effective way of marketing, and I fully agree to it. Addressing universal benefit rather than specific medical benefit ensure that the product is not painted in a corner and can open window for secondary claims and health benefits. Here I would like to dwell upon a little more since I have some time. Say for instance, if we say that soy isoflavone is to be taken for, ISO1 is to be taken for post and perimenopausal women, we are shutting the door for ISO1's clinical efficacy on breast cancer, for osteoporosis, so on and so forth. So, universal benefits are to be addressed. Do not get confined to, for Vidania somnifera, that it's an aphrodisiac. By doing so, we are switching off doors for other therapeutic efficacy. Say too instantly, if you say so too instantly, it's for your bones. You might shut the door for heart health, for calcium preparations. Calcium preparations have got multiple of benefits. Let us go with an open mind with multiple benefits. That will bring success to your brand. One of the most successful marketing approaches, as demonstrated by General Mills and Quiver, remains keep on rotating the claim with newer information. Here I would like to quote an example of Bicosul. Though I come from a different corporate, this is how the Pfizer played around the brand and made Bicosul here in India. Constant research on various claims help in expanding to reach of a variety of nutrients. Do not cease the attempt, even if we do not get a success with a particular therapeutic claim for a particular product. Keep on changing, keep on exploring. That is where the role of researcher comes into. Keep on rotating the claims. And the last dialogue of the presentation is, experts, the wizards of marketing suggest, and I do like this dialogue. There is no shortcut for nutraceuticals marketing. Key to the success are presence, perseverance, and willingness to tweak the product. A very strong brand name. This is what I feel as the ultimate ultimate dialogue to bring the success to a brand as a mega brand. With this, I thank you very much once again, and I thank VHED for giving me the opportunity, and I thank you very much for your patience hearing. Thank you very much.